Rheumatoid arthritis is a long-term condition. It affects your joints, and it's caused by the body's immune system that normally fights bacteria and bugs and things that cause coughs and colds. And sometimes it can go a little bit wrong and start attacking the lining of your joints. So this can cause swelling, pain and stiffness at the joints, and if it's untreated it can cause permanent damage to the joints. When people have a flare-up, it's very uncomfortable, it's painful, impacts on what people can do on a day-to-day basis, and moreover that's when the disease is most active. That means it's causing damage to the joints, and sometimes if we leave that going without any treatment it can cause irreversible damage. But if we get in early we can stop that from happening. So it's important to see people as soon as we can when they have a flare-up.
What we're doing is using smartphone technology to embed this in people's routines. So it's a mixture of an app through the company and then additional technologies such as thermal images, grip strength, trying to get some objective measures again just to verify over time how they're changing, how they're reacting. Because you can assess people based on the input coming from them all the time, you can understand the people who are stable, who are doing well, the level of care they require. I mean, this is a lifelong condition, so people won't necessarily need to see a consultant each time. They could see a specialist nurse, they could see whatever is appropriate. All of these things, trying to understand how it's actually working for the patient, how it's affecting their quality of life and the activities they do, requires monitoring, ideally, rather than just recollection. And it's that balance and trying to weight the clinician time as effectively as possible. So it's already available in the App Store as a early version with the questionnaires and so on. We are running tests in a couple of hospitals. We are in the process of launching it through the RUH in Bath. There's a larger study going on through Southmead, which is already using the app as well, and that will feed into this as well, where people will routinely be prescribed the app as part of their treatment care plan.